So this is Dan Hoos, Sullivan County's Director of Communications. I am here with our Public Health Director, Nancy McGraw. We haven't talked to her in a little while on video about where we are with the COVID-19 response, including vaccinations. And I think overall, actually, we're probably in a very good spot. So, Nancy, let us know what is the latest with our COVID-19 response effort.
Sure, I'm happy to provide an update. We're in a very good situation right now, both at the county level and statewide. Hopefully soon the governor will be able to announce, once the state's vaccination rate is 70% or higher, to lift all the restrictions that are currently in place, although they have been easing up and becoming, more relaxed, and businesses are opening, obviously, but in terms of the mask guidance and the social distancing and any other orders that are currently in place. I wanted to talk a little bit about Sullivan County's vaccination rates right now. We had issued a press release yesterday that indicated that over 30,000 individuals have been vaccinated between public health and our community partners, our healthcare providers. Garnet Medical certainly has done their lion's share of vaccinating, and we've worked very closely with them throughout the pandemic, both on testing and on vaccinating. And our pharmacies, of course. You can go pretty much anywhere now to a pharmacy and get vaccinated, for those pharmacies that provide that service. And we'll tell you later about a very easy way to find out who's got vaccine and who doesn't. But we actually believe that more than 60% of our population who is eligible for the vaccine has been vaccinated, and that rate is higher. And that's for a couple of reasons. One is because the data regarding vaccinations is uploaded to the New York State immunization system, and health departments and hospitals and pharmacies are required to upload that data. So it's a really good source of data to tell us what percentage of our population is vaccinated. However, there are some caveats in that, we border the state of Pennsylvania. We have a lot of river communities very close to Pennsylvania, and a lot of folks may have gone into Honesdale and other parts of Pennsylvania earlier, before a vaccine was really widely available in Sullivan County, to get vaccinated, and we would not have their records. And so we're working on a process to reach out to folks and probably ask them to call us if they're interested in having that vaccine record entered into the New York State Immunization Registry system, so they would have a permanent record available for themselves as a New York State resident, but also that would help us show that our vaccination rates are actually higher. We believe it's probably a couple of hundred people at least. And another group that we don't have the data for on vaccinations are veterans, because many veterans, not all veterans, but veterans who have gone to a VA clinic or a VA hospital to get their COVID immunization, that is reported to the federal government, and currently there's no data sharing agreement between the state and the federal government. So for those reasons, and there's probably a few others, we believe that our vaccination rates are probably closer to 65 to 70%.
And how are we doing in terms of the schools? And I think also there's going to be summer camps coming up. We have been making sure we're in good communication with those entities, right?
That's correct. We've been doing school clinics for a couple of months now. We're starting to wind down, actually, and doing our final two school clinics in the next week or two, and those are second dose clinics. So we have provided vaccination clinics for 12 to 18-year-olds, as well as opened up our clinics to the general public living in those areas for some of the outlying districts, Livingston Manor. We went to Monticello, Liberty, Fallsburg. We went to Sullivan West. And we invited, folks from the other school districts as well. And we vaccinated, I want to say, close to 700 students and an additional several hundred adults at those clinics that were held at schools. We also went to the Ted Strobel Center. We went to the Fallsburg Senior and Youth Center. We've been out to some other locations and sponsored some pop-up clinics. So in partnership with either Garnet or Sun River Healthcare to make sure that we're reaching those parts of the county where folks may not have easy access to a pharmacy, a healthcare provider, or transportation. We're also going to continue vaccinating homebound. So if you know someone, or you are someone who is homebound, or you can't get out of the house, don't have a way to get to your provider, your pharmacy for a vaccine, please call us, and we will put you on a list, and we're going to continue to do homebound vaccinations. At the end of June, we will be pulling back from the outreach clinics, and we will be continuing to have COVID vaccine clinics at Public Health in Liberty.
And if I can ask a little bit about masking. Now, there had been some confusing messages from the state about masking at schools at one point. I think that's all been resolved now, that the current guidance from the state is that if you're in a school building, vaccinated or not, you need to be wearing a mask.
That's correct, and that's the state guidance. There was some confusion because the CDC issued guidance that was slightly different, and then there was a letter that went from the state health commissioner to the CDC, kind of indicating the state's intent to better align the guidance for schools and camps with the CDC's guidance. So since then, that has been clarified, and schools, while they're in session, and that won't be much longer, will continue to have to wear masks at the schools when they're in classrooms, and certainly within 6 feet, and not socially distanced. If they're in their own private work area and there's really nobody around, that's really the policy of the school. That they follow the guidance just and use common sense in terms of, because it's about risk. I did want to mention the question about summer camps. Our office meets every year with the summer camp owners and operators and their directors, and we make a joint sort of in-service day with our district office. Now, our district office in Monticello is the office that provides permits and inspections for children's summer camps. Whenever there is an overlapping issue regarding any type of communicable disease, or anything like immunizations, COVID, measles, bats, rabies, Lyme disease, that kind of thing, then Sullivan County Public Health Services will respond to those types of issues. If there's a foodborne or a waterborne outbreak of some sort, then it's a joint visit that we conduct with our district office staff, and it's been a very strong relationship for many, many years. So I wanted to provide clarification on that. The legislature passed the public health order that was requested to be renewed again by my office this year, requiring proof of MMR, which is protection against measles, mumps, and rubella, or to show proof of immunity. That is something that's been in place since 2019, when we had that fairly large measles outbreak statewide. So we'll be talking to them about that as well. We're not planning on doing COVID vaccination clinics at summer camps. That's not something that we believe is necessary at this point, since the large number of people who have been vaccinated so far have had plenty of opportunities to get vaccinated, and we're hoping that they'll arrive already having been vaccinated. It can't be required because it is not something that can be mandated currently by the federal or state government or the local government because the vaccine is still under emergency use authorization. So it's not something that can be mandated. But the summer camp guidance that the state health department issued does cover the requirements for masks under certain situations for summer camps, and social distancing and hand sanitizing and hand washing and whatnot. So we just want everybody to have a safe summer.
And speaking to that, for those who are still unsure or worried about receiving a COVID vaccine, which I'm sure you've talked to some people, what do you say to them?
We understand that there are still people that are on the fence or undecided, or they have some questions that are just concerning to them. I would encourage them to either call us and speak to one of our nurses to address your questions and concerns that you might have, and to give you factual information about the vaccine itself and what your risks may be in terms of what we're seeing now. Instead of a large number of elderly being hospitalized and passing away due to the COVID pandemic, we're seeing pretty much a 65 to 75% vaccination rate in our older population. And so that's not a problem anymore. We don't consider anybody who's been vaccinated to be at risk, at least of dying from COVID. It's really gotten much better. The groups we're seeing now are younger people in their 30s, 40s, 50s who maybe have underlying health conditions that put them at higher risk. Should they contract the disease, the virus, and get sick, it puts them at a much higher risk of actually having to be admitted to the hospital to receive treatment.
All right. Thank you very much for your time, Nancy. I appreciate it as always.
Thank you. And there's just one last thing I want to say in terms of where to go to get a vaccine now that we're sort of scaling back. And there is vaccines.gov, which is the website. It's a federal partnership with the state and with the counties. And you can go in to that website and put in your zip code within a 50 or 100-mile radius, and all these locations, whether it's pharmacies, healthcare providers, or health departments, will pop up as options for you in terms of where you can go to get a vaccine. It is still free. There's also a number that we posted on our social media page. It's a number that you can text. Actually, I would like to say what it is now. You can text to 438829 your zip code, and it will send you a text message with a link to all the locations within your geographic area where you might be able to call and go get a vaccine.
Very good information. Thank you again.
Thank you.